Good afternoon, everyone. I think, am I audible, Dr. Angappan? Everybody, I think, hopefully
Yes,
everybody
audible.
can see the slide. So, National Homeopathy Research Institute in Mental Health, Kottayam, back with one more webinar on clinic, clinical laboratory. Myself, Dr. Jayashree Janagan from Department of Psychiatry. I welcome you all in this beautiful afternoon. At the end of the session, we will be discussing about the COVID-related investigation also. So be with us till the end of the session. If you are losing your connectivity in between, I request all of you to join with the same link again. So please post your questions in the chat box, and at the end of the session, we'll be discussing them. And you all can see our webinars in the YouTube also on the name of NHRIMH webinars. One can visit again. So to begin with the session, I request Dr. Karunakara Murthy, he scientist 2 and Associate Professor, Department of the Psychiatry, to deliver the welcome speech. I request Dr. Karunakara Murthy. Over to you, Doctor. You can unmute yourself and you can go ahead.
Yeah, thank you, Dr. Jayashree. Is it audible?
Yeah, it is audible, Doctor. Please go ahead.
Okay, thank you, Dr. Jayashree. Good afternoon to all. Today we have gathered virtually to listen to a very important and informative session on clinical laboratory and overview by Dr. Angappan, MSc PhD Biochemistry. He has done PhD from Bardar University, Coimbatore in 2007. Hello, Dr. Jayashree.
Yeah, I can hear you, sir. Go ahead.
Okay. He has 7 years experience teaching and 6 years.
Change the slide, please.
He has 7 years experience in teaching and 6 years on medical laboratory as a biochemist. Totally, he has a rich and sound experience in this field. Also, he is a certified internal auditor of NABH. He has 4 research publications in peer-reviewed journals. He is currently working as a biochemist in the Department of Clinical Laboratory in our institute. On behalf of all the fraternities, I extend a genial welcome to our speaker. Next, I would like to welcome all the participants who are eagerly waiting for the session. Hope you all have a great time ahead. Thank you, Dr. Jayashree.
Yeah. Thank you so much, Dr. Murthy. Now, I request all the participants to mute themselves. So now I request our OIC. Okay, so much noises here. Just give me a minute. Yeah, I think now it's.
Hello.
Yeah.
Yeah.
Still,
So
it is
please,
noises there in the background.
requesting all of you, please
I,
mute your mic.
I request all the participants to mute themselves.
Still,
We have muted.
like if it is not, please mute yourself.
We have
Yeah. Okay.
everyone from here,
So
sir.
yeah, thank
Yes,
you,
sir.
Dr. Jayashree. Thanks to all. This is our webinar series. It is the second one, I think. No, third one, I think. Third one of this series. So today we'll be discussing about the clinical laboratory and overview. And I think of all these participants will be gaining many things from this webinar, because actually others, those who are seniors, those who are doctors, will be a refreshing things. Those who are undergraduates will be a new things. Those who are PGs also will be adding more into this, into their knowledge. So this will be a benefit for all the sections of the people across this medical fraternity. So in this area of COVID, so we are only talking about COVID always. So we have to learn other things also, other dimensions also. So that we thought actually there is a series of on this clinical laboratory, and I welcome all the participants. And I think still it is increasing. Is right now we have 47 participants. Again, we are expecting that more participants for this session. And I'm welcoming all the people, especially the resource person, Dr. M. Angappan. He's a learned person. He's a PhD in biochemistry, and he's. I'm proud to say that he's one of our very active faculty of this National Hospital Research Institute in Mental Health. So thanks to one and all. So enjoy this session. Thank you so much.
Thank you. Thank you so much, sir, for your valuable suggestions. So let me read out once again about his profile for all of us. So he's Dr. M. Angappan, MSc. He has done MSc and PhD in biochemistry from Coimbatore. He is working with us as a biochemist. He is an expert in creating standard operating procedures, quality system procedures, and manuals, records, and documents for international accreditation. He is a certified internal auditor from ISO since 2012 and NABH since 2018 in medical laboratories. He has vast experience of in the medical laboratory as a biochemist and a quality manager, and also 7 years of experience in teaching. His area of interest is on male infertility facts. His PhD thesis was on phytochemical antioxidant and anti-infertility efficiency on and miracle in ethanol-induced infertility in male albino rats. He is also holding 4 research publications in the same topic. In all these research articles got published in peer-reviewed journals. He presented a paper on vitamin D3, a healer of cardiovascular diseases, in national conference held in January 2018 at Bharatidasan University, Tiruvarur. So I welcome Dr. M. Angappan, requesting you, sir, to share your PPT. Over to you, sir.
Good afternoon, ma'am. Thank you, Onadol, for introducing me. So I'm going to start with.
Yeah.
Hello.
You can share your PPT, sir.
Okay. Okay. Good afternoon once again. I am Dr. Angappan. As I said, I am a biochemist working in National Homeopathic Research Institute in Mental Health. So I'm going to talk on clinical laboratory and overview. The introduction itself tells you, it's a laboratory of Lavoisier. Actually, who introduced the oxygen theory, basically. This oxygen will in turn react with carbohydrate, basically glucose will give you water and carbon dioxide. This is the first theory who introduced the oxygen is a combustion reaction in which a lot of exothermic reaction is going to take place, actually is taking place, and we'll have a heat energy which is giving us energy for doing all the sort of things. And coming to clinical laboratory medicine, in the sense, actually previously there is no laboratory medicine. Now nowadays basically it's a separate department in medicine in which The discipline mainly involved with the selection of test and and interpretation of diagnostic testing that uses medical samples from the patient. Next. Not going. Okay. So the definition of medical laboratory as far as ISO 15189-2012 is actually ISO 15189-2012. It's a clinical laboratory standard in which we have total of 160 standards. Whereas in NABH we have a total of 20 standards. NABL is more specific for clinical laboratory. NABL meaning that National Accreditation Board for Testing and Calibration Laboratory. And whereas NABH is National Accreditation Board for Hospital and Healthcare Providers. Actually, NABH has a definition as far as clinical laboratory is. It's a laboratory for examining materials derived from human body for providing information for diagnosis, management, prevention, and treatment of diseases. Whereas this CAP is the College of American Pathology. It's also one of the certification. NABH is for both the hospital and also we have some laboratory standards also. When compared to hospital, the laboratory standard for NABH is somewhat high as far as laboratory goes. But NABL is a major basic standard in India that is called ISO 15189-2012. And the first slide, as far as what are all the materials we are used for examination in the sense actually anticoagulated whole blood. The whole blood, for example, for doing HbA1c like test, and or we used to separate serum from whole blood and plasma also. And basically, the difference between serum and plasma is without adding any anticoagulant, we'll rest the blood for 45 minutes or whatever it may be. We'll get a clear fluid which is called actually serum without adding any anticoagulant. It will have blood minus cells. Actually, serum will contain won't contain fibrinogen, whereas plasma has a fibrinogen because clotting is not taking place. So fibrinogen is preserved in plasma, whereas in serum we don't find any fibrinogen. That is the difference between serum and plasma. And feces is the other important sample. We used to do it in the laboratory for simple tests like OVA and cyst, sometimes hemocal blood and other microbiological examination also. Frequently, we are using other body fluids like urine, CSF, semen analysis, and sputum, and ascitic fluid, which is also called peritoneal fluid, and synovial fluid for diagnosing rheumatoid arthritis and other joint-related problems, and pleural fluid, for example, to identify tuberculosis by means of doing ADA, adenosine deaminase, and pericardial fluid for also doing certain tests, carditis like thing, and amniotic fluid. We used to do it for prenatal testing, like trisomy and monosomy like things, and that CAPT fluid is nothing but a continuous ambulatory peritoneal dialysis fluid, which is also we used to get for testing in our laboratory for doing glucose and other electrolytes in the CAPT fluid in order to adjust the dialysis schedule of a kidney patient. And the sweat is also another important sample, which we are doing it for diseases like cystic fibrosis, like thing, and saliva, common nowadays they used to do for anti-HIV testing also, and for alcohol also. And we have a solid tissue for histopathology laboratory and pathology laboratory. And basically, hair and nails, basically they are doing it in a forensic laboratory, because hair is having trace metal. Actually, it is getting fixed. These trace metals are getting fixed in the hair, so that hair sample can be done to analyze trace metals. And as far as the scope of a laboratory, each and every department has its own scope actually. As the same way, in clinical laboratory also, this medical laboratory also, we have 7 major type of departments. The first, you all know, it's a clinical chemistry, in which we used to do all chemical analysis. Chemistry now basically sugar, urea, uric acid, creatinine, cholesterol, liver function test, like that test we are doing in the department of clinical chemistry or clinical biochemistry. Previously, we used to say clinical chemistry only because it basically orients with all chemical matters, no, carbon, nitrogen, oxygen, nitrogen, sulfur, and everything. And of late, a latest term which has come, which is called clinical biochemistry. But right word, I think, is clinical chemistry only, because most of the reaction has its own chemical principle rather than biological principle. And next is hematology and hemostasis. Actually, hematology, as far as in our lab, we are doing complete blood count analysis. Other than that, we are not doing any special test. Whereas hemostasis and thrombosis is a very important part of hematology lab, in which now we used to do prothrombin time and activated partial thromboplastin time, and also all coagulation proteins like protein C, protein S, and other things we are doing. And whereas clinical pathology is also one of the important section, you all know it's mainly deals with urine and feces. As I said, no, urine complete, it's a part of clinical pathology lab, and doing feces for ova and cyst, and examining feces for presence of vocal blood all comes under clinical pathology scope. And microbiology and serology, actually it's a special department. It is dealt by means of a microbiologist, and serology is also under microbiology, and virology is also under microbiology. But virology lab is very rare because no virals can spread like anything. Whereas in a microbiology lab, ordinary we used to do culture and sensitivity and identifying microorganisms by growing them and putting them in antibiotics, so that how it is reacting, whether it is sensitive or resistant or whatever it may be. Serology, as far as I know, it's a very good branch. Of late, it has been developing like anything, in which we used to do HIV, HPSAG, HCV, all serological analysis based on antigen and antibody reaction. And we are going to discuss in an elaborate manner what are all the serological tests and what is the basic principle of serological test, everything in the coming slides actually. Histopathology is, hello, hello. Ah. Histopathology is a section, actually, it is more concerned with a tissue actually. Cytopathology is a cell. Histopathology examination doing all biopsy tests. And cytopathology is nothing but doing something in the cell. For example, FN is a fine needle aspiration testing for identifying thyroid, what no malignancy or whatever it may be. And drug monitoring we are not doing actually, but most of the laboratory, they are doing drug monitoring. If suppose there is a nephrology department, that drug monitoring is important, because patients after transplant now they used to give sirolimus like tacrolimus, sirolimus, and cyclosporin drug they used to give to patients, no, in order to prevent a graft rejection. In that case, they have to monitor the drug. So they are in need of laboratory to analyze whether the drug is sufficient or not to prevent graft rejection. Whereas we are not basically, doing drug monitoring and everything. And toxicology is important for forensic lab for what to detect, for example, cannabinoids like thing. And even in allopathy hospitals, they used to do even paracetamol poisoning. We have to do the level of paracetamol in serum, and for monitoring digoxin also, and for monitoring other toxic drugs like clonazepam and diazepam, like drugs actually, so that that sometimes a patient will in a vested interest will take a more number of these type of tranquilizers or whatever it may be. Thereby the drug monitoring plays a vital role in the laboratory. And blood banking is a separate branch of medicine, in which nowadays it is called transfusion medicine, and a lot of specialties has come with respect to transfusion medicine. It basically deals with what blood blood testing in the sense actually grouping and everything, and blood transfusion like thing. Now they are doing it now, matching Coombs test and everything. So we have in our hospital, we are doing clinical chemistry test, hematology, to some extent clinical pathology test also, and also some serology test like RA, CRP, and everything. Next. So this is my subject actually today is medical laboratory. Basically, no, this medical laboratory process is taking place in the three major categorical way. The one is called the pre-examination process, or otherwise it's called the pre-analytical process. Both are same only, because before doing examination, we have to draw blood. Actually, This plays a crucial role, because most of the errors occurs in the pre-analytical area only. A lot of research paper are saying that the pre-analytical error will account for 62 to 76% of errors of a total report. Actually, pre-analytical in the sense identification of patient is very, very important. Patient name, sex, age, and its UHID number, and what is the clinical diagnosis, and what are all the tests there in the agreement. Agreement in the sense is a request form is like an agreement. So we have to treat the request form as an agreement, and we have to fulfill the request of the client so that the other two processes will go well. Without pre-analytical phase, now we cannot enter into the analytical phase and post-analytical phase. And the analytical phase is nothing but doing examination. Nowadays, no, doing examination, machines are doing examination. Actually, humans are not involved in doing examination because automation has come. We have to just put the sample and the result will come. The thing is that what way we are putting the sample, in which way we are putting the sample, in which way we are identifying the sample, everything depends upon pre-analytical process. And post-analytical process is nowadays no, just to write the report and distributing the report to the sections and dealing with interpretation and dealing with queries and reporting critical values. These are the things, and how we are disposing waste also will have its own impact in post analytical phase. Next. So as far as pre-analytical examination, specimen collection is very important. So what we are doing now, basically in a small lab now, we are doing three different types of blood sample. The first one is called venous blood by doing venipuncture. Oh, it's a specimen of choice for most of the laboratory tests. No, it's for biochemistry also, serology also, microbiology also. So even for cytopathology also, or whatever it may be. And capillary blood is the second thing in which no, we are doing skin puncture. It is very easy. So that blood we can use it for point of care testing. That is POCT means point of care testing. Doing blood sugar level in home is one type of point of care testing, but you should be trained with doing point of care testing because a lot of errors will happen. And if you are putting a particular machine, a point of care machine in the laboratory or in the sections of your hospital or whatever it may be, if suppose you are having an POCT machine, this POCT glucometer, for example, I am saying it should be under control of the laboratory, calibration and everything we have to take care. One more fine example for another POCT machine is blood gas analysis. Actually, we are not doing any blood gas analysis here because it mainly deals with arterial puncture. And the next thing is that arterial blood, mainly for doing blood gas analysis. And the arterial puncture, actually doctors will do the puncture. Trained doctors will do the puncture. So phlebotomists can't do, and even nurse practitioner are not allowed to do any arterial puncture unless otherwise they are trained in arterial puncture. This arterial puncture, they used to do it in radial artery, brachial artery, and femoral artery. Radial artery is the first choice, and second choice is femoral artery. Next. So this is a very important slide as far as laboratory is concerned because no drawing blood is a very it's a procedure actually. We are everywhere we are doing surgery like because we are something doing with the vein actually. We are picking up the vein and we are puncturing the vein. That is why it's called phlebotomy procedure. No, so procedure has its own risk always. So the process of collecting blood is called phlebotomy. So people who are trained in phlebotomy can allowed to perform the procedure. So phlebotomy, it's a very, very, very tough. No, I'm not saying tough. It's a art actually. No, after practice only, you will become a very good phlebotomist. Sometimes, no, if you're not able to pick up the vein, it's a very big problem in front of the patient, and a lot of phlebotomy related issues will come that we have to manage. And for doing phlebotomy, I should say that 19 to 22 gauge needle is very good. Whenever there is a decrease in gauge size, what happen? No, the pore size will in turn getting increased. So if bigger will be the pore size, then hemolysis can be prevented. If suppose larger will be the gauge size, then hemolysis will happen. The needle is very thin. I don't feel any pain. But the hemolysis is one of the culprit for doing all the tests. And we are putting one tonic to our your arm, in order to identify the vein. The tourniquet application should be 4 to 6 inches above the puncture site, so that we can avoid hemolysis. For example, you are ordering one the test now, doctor is doing a potassium test. The potassium test value should be low for the patient, but the value is more than 6. Suddenly you have to come to the lab, sir, what happened? Our patient potassium is very high, but clinically the patient is all right. You don't have any renal illness also. Then we have to check it out, the phlebotomist. Then we have to check it out, the tourniquet application time also. Maybe he left the tourniquet for more than 1 minute. It may lead to what? Hemolysis. And the important thing is selection of vein. It's a core part in doing phlebotomy. So we usually do.
Excuse me, sir.
Yes, ma'am.
If it is disconnecting in between right now, I request everyone to use the same link to join back again, sir.
Ah,
Yeah, yeah. Go
you
ahead,
want
sir.
me to help, ma'am?
No, you can continue, sir. I think it may
Okay.
the connectivity we may lose. That
Okay.
way, I'm
Okay.
requesting everyone to come again with the same link. Yeah, yeah. Okay,
Okay.
sir.
Okay.
Go
Okay.
ahead, sir.
Shall I? Okay. So the median cubital vein is a choice of a vein actually in the antecubital fossa. So it's a very easy to detect, and it's a supportive vein also. And the second thing is that cephalic vein is the next choice. And if you don't find cephalic vein also, you can go for basilic vein. But the problem is in basilic vein, we have that brachial artery is there below, and median nerve is also there. You accidentally puncture these two things, then patient will have enormous pain. That is why now we used to select a median cubital vein in the antecubital fossa. And the site preparation, actually we are using spirit. Actually we have to use 70% isopropanol. It's having both it's having both antimicrobial activity. Antimicrobial activity in the sense it's having antibacterial activity, antiviral, and antifungal activity also. So if you want to do first with ethanol, you want to quantify amount of ethanol in blood, then you have to go for a benzalkonium chloride, because isopropanol will have an interference with the analytical process. So there may be a high value in your report. So in order to avoid this, we can use benzalkonium chloride, but it's a very rare test. Clinician will seldom ask for this blood alcohol level. And this capillary puncture, no, I want to talk a little bit on capillary puncture, because the capillary puncture can be made in the finger and toe for infant and newborn babies, actually neonates, and earlobe we can do capillary puncture. For adult, actually, for doing POCT test, that is point of care testing. For example, doing glucose sensing in glucometer, we can actually prick the capillary in the finger. Whereas no, capillary puncture can also be done for neonates for identifying inborn errors of metabolism. It's a very important thing actually. Off late it has picked up like anything. When baby born immediately after a week or after 5 days or a week, no, doctor will order newborn screening, especially for congenital hypothyroidism, in which we have to test this TSH level. And one more important thing is G6PD, in which we need this capillary blood. G6PD is nothing but a glucose 6-phosphate dehydrogenase. It's a key enzyme which catalyzes glucose 6-phosphate into 6-phosphogluconate. During this process, a lot of reducing equivalents are produced. These reducing equivalents are nothing but NADPH. This NADPH is very important for this hemoglobin, in the sense actually cell will experience oxidative stress, no, when you don't have very low amount of this NADPH. And so there is no NADPH, the oxidation process will take place, and you interfere with these things actually. For example, treating patient by giving antimalarials like primaquine, no, automatically what happened, we have to check for this glucose 6-phosphate dehydrogenase before giving the drug to the patient.